Hello, today we are going to talk on a small topic called NIPT. NIPT is a screening technique. It is called non-invasive prenatal testing, where the mother's blood is drawn like you draw blood for any blood test, like sugar, thyroid, like that. Blood is drawn from the mother, and from the mother's blood, the fetal blood is taken. So in the mother's blood, there is always fetal blood is running around. So a cell-free DNA sample of the fetal blood is taken from the mother's blood. Now this cell-free fetal DNA comes from the placenta of the pregnancy. Now from this, they take out fetal DNA, and this fetal DNA is the mirror image of the genetic makeup of the baby. So it's a mirror image of the genetic makeup of the baby, and hence with this we can diagnose certain genetic disorders. So the most common genetic disorders which we can diagnose are the trisomies, the Down syndrome, Edwards syndrome, Patau syndrome, and also the sex-linked aneuploidies, sex chromosome aneuploidies, like the X and Y aneuploidies can be found out. And there are certain other genetic disorders which can be found out through this NIPT testing. The advantages of this NIPT testing is that it's a non-invasive test. So there is no harm to mother and baby. Second thing, it is early detection. Rather than waiting for a long time, you can detect early, and it can be done after 10 weeks of pregnancy. So after 10 weeks of pregnancy, NIPT can be done and detected. Third thing, advantage is it is a very high detection rate for Down syndrome, almost 99%. For the other syndromes, maybe 97 to 98%, but for Down syndrome, almost 99%. Now, what are the limitations of NIPT? The limitations of NIPT are, number one, it is expensive. So it takes a quite amount of money to do the test. Number two is that it is a screening test, yet it is not a confirmatory test. So if you find out any abnormality also, we have to do a confirmatory test on that to prove it. Third thing is that not all genetic disorders can be found out. So some specific then can be found out and done. And hence, NIPT is a good tool to rule out major genetic abnormalities in the baby, and should be aware that it is available and can be used by all of us. Thank you.